Good evening. On behalf of the Deming Center at Columbia Business School, thank you once again for joining us. Today, along with recognizing the exemplary leadership of our awardees, we would also like to express our heartfelt gratitude to each and every healthcare worker in the world. Thank you for your selfless and tireless dedication towards providing care and saving lives through the COVID-19 pandemic. We are incredibly grateful for your tremendous service to humanity. And now it is my pleasure to welcome our next presenter, Marie-Josée Kravis, who will be introducing our final awardee for the evening. Marie-Josée is a renowned economist specializing in public policy analysis and strategic planning. She is a published author and a prolific columnist and contributor to various Canadian and US newspapers such as La Presse, The Gazette, and The Wall Street Journal. She's a member of the International Advisory Committee of the Federal Reserve Bank of New York, a senior fellow of the Hudson Institute, and president emerita of the Museum of Modern Art in New York City, where she served as president for 14 years. She was instrumental in the establishment of the Marie-Josée and Henry R. Kravis Center for Molecular Oncology at Memorial Sloan Kettering. The center is a unique and intensive effort to transform cancer care through the genomic analysis of patient-derived tumors. She is chair of the Sloan Kettering Institute and vice chair of Memorial Sloan Kettering Cancer Center. Ladies and gentlemen, please welcome Marie-Josée Kravis.
I'm delighted to introduce physician-scientist Dr. Craig Thompson, the Chief Executive Officer of the Memorial Sloan Kettering Cancer Center, the world's oldest and largest, and I'd say one of the best private cancer centers. Now, if I had to find one word to describe Craig Thompson, the word that comes to mind is polymath. Craig is a physician who is deeply devoted to patient care. He oversees over 20,000 employees, more than 500 beds, more than 840,000 outpatient visits per year. He oversees an education program that involves roughly 13,000 people, nurses, fellows, postdocs, and students enrolled in continuing education. He oversees one of the world's leading cancer research programs, ranging from basic science to translational medicine to roughly 1,000 clinical trials per year. But the word polymath extends beyond MSK. Craig is an avid reader, insatiable curiosity. He is a keen sportsman. I'm told he's a wonderful cook, and that in fact his salmon recipe is hard to beat. And of course, I was terribly impressed by his knowledge of rock music when I brought Roger Daltrey of The Who to MSK to help with the fundraising event. But I decided to ask people who work with Craig, either in the hospital or in management or in his lab, to tell me about him. And here are some of the responses that I received. The most impactful mentor I've ever had. The most well-rounded genius I've ever met. But one expression that recurred time and time again was the expression, glass half full. And that's what a leader really is. Someone who can inspire, someone who's ambitious, an innovator, determined, and someone who administers hope with rigor. I can't think of anyone more deserving of the Deming Award.
Thank you, Marie-Josée, for that kind introduction. I would first like to thank my fellow honorees, Mike Dowling and Kevin Sowers. Without their leadership at the height of the pandemic, things would have been much worse. We are honored that the Deming Cup Judging Committee selected healthcare leaders in this complicated year for all of us. MSK has long been dedicated to continuously improving the prevention, diagnosis, and treatment of cancer. We accomplish this through reiterative cycles of research, patient care, and education. When the pandemic hit New York City on March 1st, we were actively treating 150,000 cancer patients. We knew from earlier reports out of China that cancer patients would be at higher risk of catching and dying from COVID-19. At the same time, the staff were susceptible to this emerging disease. So there was fear and uncertainty, not only in the community, but across the institution. It was at times like these that organizational commitment to excellence matters. Cancer does not shelter in place. We had to see our patients safely through their treatment. We had to keep our staff safe. We had to absorb the impact of COVID and maintain our mission. Thanks to the teamwork and resilience of our staff at all levels of the organization, we were able to rapidly craft a new operational framework and adapt. Thanks to our laboratory staff, we developed and deployed the first FDA-approved test for COVID in New York. The rest of our research staff was sent to work from home, allowing us to redeploy the PPE used in our research labs to support our clinical caregivers. Early on, following MSK's long-term commitment to the scientific method, we adopted a plan to mask everyone, patients and staff, that entered our facilities. Ventilators were in short supply, so our critical care team made the commitment to use proning in the initial management of COVID pneumonia, and it worked. We purchased hundreds of pulse oximeters that were sent home with patients with early symptoms so they could be safely managed at home using telemedicine. At the peak of the pandemic, we were performing 2,000 telemedicine visits daily. And most importantly, we shared with and learned from our fellow healthcare organizations. As a community, we adopted and shared whatever worked. We were all in this together. These trying times are not over, but over the last 6 months, MSK's commitment to operational excellence in the face of adversity has allowed us to maintain our cancer care mission. Thank you for this recognition on behalf of all of Memorial Sloan Kettering.